Welcome to another edition of Dan Factoids. In this edition, we'll be addressing the issue of ovarian cancer and diving. Keep watching. We got a question from a diver who had ovarian cancer, received chemotherapy, and was declared cancer-free, but subsequently developed a pulmonary embolus, which is actually a little bit unusual, but certainly can happen. So the cancer no longer seems to be a problem, save this. Part of the chemotherapy regimen for breast cancer sometimes includes bleomycin. And bleomycin has the tendency or may introduce the risk of pulmonary fibrosis if exposed to elevated partial pressures of oxygen. So for this individual, I would recommend shallow diving and certainly not oxygen-enriched diving, for starters. The second component to the question was the deep venous thrombosis. Now, the way we think about deep venous thrombosis is essentially whether it is above or below the knee, and whether or not the medication is appropriate and safe or not. It's very unusual for a thrombus that is under the knee to cause pulmonary embolism. But in this particular individual, there was pulmonary embolism. So lung function assessment and proper evaluation of the recovery of the lungs is important, together with ultrasound of the thrombus to confirm that it has stabilized and, if not disappeared, that it is restricted entirely to the lower calf. We would recommend that you see a hematologist, which you may already have done, and assess the risk of getting further pulmonary emboli. And then also, secondly, the medication, certain medication like warfarin, we have some reservations, but there are more and more divers diving on Coumadin or warfarin. But there are more modern medications that nowadays are acceptable to attenuate or to limit the risk of deep venous thrombosis, and they may be appropriate for you. So I don't have a simple answer for you other than to say that your oncologist, pulmonologist or specialist physician and diving physician should weigh in on the question of whether or not it is safe for you to dive. I wouldn't recommend that you just go off diving, and even if you do, that you restrict your diving to non-remote locations. Don't go diving off in areas where medical help is not readily available, and of course consider how you feel when you go diving. Don't dive if you don't feel well or if there is pain in the calf, for instance. Thank you for this question. I hope the answer was somewhat useful, and until next time, safe diving.